Let's begin with pricing. The president isn't talking about drug prices any longer, at least not for the moment. But there remains a great deal of interest in how drugs are priced. And drug markets appear to be getting increasingly competitive. From your perspective, how have the dynamics changed?
Over the last year? Well, I think we did, as an industry, I think, rein in some of the most egregious actions. Those weren't mostly from innovative companies, but we didn't see the headline-grabbing massive price increases last year. And that's a good thing. We all get painted with that brush. We've done some work with payers as an industry, and certainly Lilly, to try to help patients afford their medications at the pharmacy counter. So, for instance, Lilly announced a program to discount insulins for anyone who shows up at the counter by 40%. If you're a cash payer, you're in a high deductible plan. We need more of that kind of innovation because, of course, as you know, the insurance system is bearing less and less the cost of medications, and that's being shifted to consumers. So we need to innovate and create new ways for people to afford the medication at the counter. Even if they have insurance, their prices are going up. I think the final thing is new pricing on new innovation. And last year we saw tremendous new scientific breakthroughs, gene therapies, et cetera. And this
but it's expensive.
It is expensive to do. You have expensive development programs for a small group of people. How to spread out that cost, how to back value of those, and make sure that the healthcare system is paying for something that works. We need more room for experimentation. CMS, which sets the guidelines in the U.S. for a lot of that, has been a little slower than what I would have expected in coming out with new frameworks to do that. But I would expect some action this year from them to allow drug companies to do different things, for instance, spreading out payments over a longer period of time, or value pricing.
Even if the upfront cost is very high.
Or value pricing, saying pay us when it works, not when it doesn't.
Indication-based or outcome-based pricing.
Exactly, yeah. So we're still waiting for some of those policy moves, but I would expect them coming up.
Can you do any of that on your own?
We do that on our own. The places where it can work are in the so-called advantage plans, where you have a plan provider for a senior that has all of the costs, and they have some latitude to trade off hospitalization costs for drug expenditures. And in some, I would say, forward-looking commercial plans, typically on the coasts, who own all the costs and really want to see movement toward a value-based scheme. So we have several dozen of these, particularly in diabetes, where we take the risk on lowering blood glucose, and we get paid when the drugs actually work.